There are more than 2,200 available hospital beds in the state of Georgia. Nailing down, though, just how many of those beds are filled up or being used by coronavirus patients, well, that's difficult to nail down during the midst of this pandemic. But we do have new numbers, new information from area hospitals. Emory Healthcare, which operates 7 hospitals in the metro area, is reaching capacity, according to a physician who works at one of the hospitals. But they tell me they're spreading patient flow among the units to make space at the busier facilities. Piedmont Hospital tells me their situation is stable when it comes to hospital beds. Right now, they're making sure they're prepared for the weeks ahead with a plan for additional beds.
And we're doing that, looking at all areas of our hospitals, which areas we could convert and utilize as additional patient space if we needed to.
On Monday, Piedmont will add 42 ICU beds with the opening of the new Marcus Tower. All 100 beds at Grady Hospital's intensive care unit were full 2 weeks ago as the virus ramped up in the state. Viral patients have been quarantined wherever the hospital finds space. But Dr. Elizabeth Ford with the DeKalb County Board of Health says it's the rural communities that will be hit the hardest.
But I'm very concerned about these rural areas where before COVID was even a name, we had challenges just having basic health care. There are still, I believe, at least 30 counties in the state that don't have a pediatrician. And so when you talk about gaps and just basic healthcare needs like that, something like this could really decimate a community.
Albany is one of those rural cities. At Phoebe Putney Memorial, the number of COVID-19 positive patients in beds in their hospital more than doubled from the same time last week. And we spoke with a physician at Wellstar who wasn't able to give us specific numbers because they say the number of coronavirus patients admitted and discharged changes every day. Protective equipment for staff, nurses, and doctors. The hospitals that did get back to us say they have a stable supply, but their greatest area of concern is masks. Piedmont says they have received a limited supply of key items from the federal government stockpile.